You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History. Minor Family Dentistry would like to bring you the following dental health tip. It's recommended to have a dental checkup no later than your child's first birthday. An adult should brush for a young child and monitor older children's brushing to ensure a good job is done. Flossing should start when teeth are touching. Minor Family Dentistry wishes you good dental health. Families, including children of all ages, are welcome. Minor Family Dentistry, 1010 Downing and Hayes. Find them in the Next Tech directory.
Now at the Sternberg Museum of Natural History, it's your chance to enjoy feelings from fear to fascination with Rattlers exhibit. With 23 species of rattlesnakes native to the United States, it's the only place to view all 23 species at the same time. Enjoy snakes from all over the country. Learn the facts about these snakes, including where they live, interesting behaviors, and why they're undeserving of their bad reputations. We'll see you soon at the Sternberg Museum of Natural History, right down the street, 3000 Sternberg Drive, Hayes, Kansas.
Hello, and welcome to You and Your Young Child, the program devoted to early childhood. My name is Dana Stanton, and I'm the coordinator of early childhood grants for USD 489. And with me today is Kris Schulte. Good morning, Kris.
Good morning.
Now, first of all, tell us what organization you work for and what do you do there?
I work for USD 489 Early Childhood Connections, and I'm the Early Childhood Mental Health Consultant and Coordinator.
Now, May is a special month, so tell us what's happening in May.
It is Mental Health Awareness Month, and then Children's Mental Health Awareness Day is on May 9th.
Now tell us about that day. What happens on that day?
It is a time to celebrate children's mental health and also have it more as a awareness time for people, to have them aware that children do have mental health concerns. They have social emotional skills that need to develop. And so it's just letting people know that that's an important part of childhood.
Now, as a community, are there any activities that we're planning to do that will be available for parents? What's going on in our community?
Well, we have purchased this book here, Glad Monster, Sad Monster, for licensed child care providers in the community. And in addition to the book, there is a sheet in here that gives them some ideas for extending activities beyond just reading the book. And so and it's a book about feelings. Glad Monster, Sad Monster has a lot of different feelings in the book, and there's also a mask that children can put on with each feelings to kind of try out that feeling and talk about it.
Now, Kris, I'm going to vary from the list. Why is it important for young children to be in touch with and be able to identify their feelings?
So they can communicate if they're upset about something, if they're sad, mad, scared, happy, so they can communicate with other people instead of having behavior.
Now, why is it important as a community that we're aware of children's mental health?
There was a Yale study that was done in 2005 that indicated that children 3 to 4 years old were expelled from preschool more often than children K through 12. And so that really says that we really need to focus in on early childhood and those skills, teaching them those skills, so when they get older, they are able to communicate with others, interact with others, and be successful in our society.
Now, I know a lot of people will think they've heard of the term mental health, but they don't associate that with young children. I mean, what does that look like when you say mental health? Is the appropriate word social emotional, or how does that work with young children?
Well, really, mental health, the symptom of not having or having poor mental health is challenging behavior. That's what we're talking about, is behavior. And what we mean by challenging behavior for young children is if they are unable to do everyday activities because of their behavior, such as if they're not able to sleep or if they're not able to eat because of behavior, or do everyday activities like going to the grocery store or going out to eat with their parents. If it's because their behavior, then that is an issue that a parent or a caregiver would want to find out some more information about.
Now, say that you're a parent or a caregiver or a grandparent, there's someone in your life, a young child, that you have concerns about. In our community, what would they do?
Well, they could certainly talk to their physician. We have screenings done at the Hayes Area Children's Center called the Hayes Interagency Coordinating Council screenings once a month. They could call the Children's Center at 625-3257. We also have a great website called hayesparents.com that they could go on to find out some resources in our community that could help them with the issues that we talked about.
I know a lot of people might say, well, I can't afford that. Are there programs that could help a child that maybe the family had a financial need?
Yes, there are. For example, myself, I would be able to visit with families without any cost. They could call me at 785-735-4207, and I could visit with them about what their concerns are and about what resources are in our community.
Okay. So, any final words? Now, I'm thinking about Glad Monster, Sad Monster. You said that we've sent these to child care providers. If mom wanted to go get one of these, or dad or grandma, would this be appropriate for families?
Oh, sure. Yes. You can go on. There's a website called the Cepha website, which you could go on and look at what other books are available to look at early childhood social emotional skills. And I also wanted to mention we were able to send this out because of grant funding that we received from United Methodist Health Ministries Fund. And that enabled us to send that to all the child care providers. So there's lots of books that are available, and if you, again, hayesparents.com, you can go on there and find out what resources might be available, such as books that would be good to read to your young child.
Awesome. Kris, thank you so much for being here with us today. Some really great information.
Thank you.
You've been watching You and Your Young Child, the program devoted to early childhood. Parents, remember, you are your child's first and best teacher. Thank you.
Thanks for watching You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You can watch the program weekdays in the noon and 9 o'clock hours. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History.